Senator Chris Murphy held his latest opioid roundtable in Bristol, which calls itself a recovery-friendly city. It got a $150,000 state grant, and one thing it did was print some brochures.
This one that says you have survived an opioid overdose is with our police department, and when they respond to calls, this brochure comes out of their med bags and is left at the home or with a loved one.
Over at Bristol Hospital, addicts brought in caught with drugs have a choice.
They're going to be given the option to either go to jail or come to the hospital for recovery. And of course, that's to the discretion of the officer. But really, that allows us to capture a patient who needs help in that moment.
While communities like Bristol are trying to fight the crisis and prevent overdoses on the very local level, Murphy says he is part of an effort in Washington to try to track the problem at the national level and try to stop it at its root, the doctor's office.
That really is, I think, where we're failing, addressing up front the ways in which we can manage people's pain such that they never, ever take a pain pill. We're still seeing, 80% of the folks who end up in overdose starting out on prescription pain medication.
Another part of what Bristol has done with that state grant is to go around and talk to people affected by the opioid crisis, recording their interviews, and those will be released later this month as public service announcements. In Bristol, I'm Kent Pierce, News 8.